Did you know that depression can cause you tensional headaches, which sometimes our health workers are not able to discover? Welcome to Mental Health and Science with Dr. Enoch Francis. Today I'm going to teach you about depression, what are the causes of depression, the signs and symptoms of depression, and how we can manage it. So, depression affects around 350 million people worldwide, and it is a common mental problem, a common mental disorder, but sometimes it may present with symptoms that you cannot understand, or the health workers may not understand. So we have to begin by understanding by what is depression. Okay, so if you are new to this channel, I request you to subscribe, like, comment, and share, because the information that we are going to share is going to help you to support other people outside there. So depression is a mood disorder, which is characterized by having persistently low mood, or you persistently feel sad and also lose interest in in daily activities or in the things that you used to like. So mood is how we feel. Like, you can feel happy, you can feel sad. Sometimes it is there you are like, say, 50-50, that is called flat. So depression is a condition whereby you feel persistently sad for about 2 weeks when you are not expressing any happiness at all. Okay, so how can we know that someone is depressed? How can you know that my partner is depressed, my relative is depressed? So these are some of the signs of depression. But the first thing that you have to know that these signs and symptoms must have happened for at least a period of Of 2 weeks. So one of the signs and symptoms that we have to know is that persistent sadness. Okay, I know each of us can be sad, like you feel sad, maybe in a day you will find things are not happy, maybe things are not moving on well, you feel sad. Okay, that one doesn't mean that you have depression. Okay, but we are talking about persistent sadness. Okay, the first week, Monday, Tuesday, Wednesday, Thursday, Friday, comes to Sunday, you are not experiencing any happiness. You go to the second week and you are not experiencing any happiness. That is called that is a sign of depression. Then another sign is that most people who are depressed, they lose interest in the things that they used to like. Okay, for example, if someone used to like singing or listening to music, they no longer want to listen to music. Okay, if someone used to like maybe to go out, maybe used to go out for tourism, used to go out to hang out with other friends during the weekend, they are no longer doing that. So that is loss of interest. Then another thing is sleep problems. Okay, people who are depressed, they have challenges with sleep. Some of them may have difficulty sleeping. You find the whole night they are still awake. Some people may oversleep a lot, like they stay in bed for a long period of time. Then another sign is isolation. These people like staying alone, and this is how you can also tell that someone is depressed. Like, they want to be alone in the house, they want to be alone, they don't want to associate with other people. So this is also another sign. Then there is also low appetite. Like, someone doesn't have appetite for food, and you find them also, because they don't have appetite for food, also there is also there is also weight loss. There are few people who are depressed who gain weight, because also you find when someone is overeating. Then another thing that we can know that someone is having depression is suicidal ideations. Okay, someone all the time they feel they are not worth living, and they talk about killing themselves. Say, I feel like I should kill myself. I should end my life, or I sleep and I should not wake up. Sometimes some people can even write wills. They try to attempt trying to kill themselves. Okay, and you find them, they have written suicidal notes. They find them trying to put ropes under their neck or to swallow poison. That is a sign of someone who is what? Who is depressed. Then another thing is headaches. Okay, some people of them, they get headache, which sometimes the health workers may not discover. So someone can present with the physical symptoms, general body pains and all that, but it is all about what? Depression. So then another thing is people with depression, first of all, also they have what we call self-blame. Okay, they blame themselves for the situation that have happened in their lives. They have that guilt, so they feel I'm not worth living because I did this and this and this. You find they blame themselves for certain kind of what situation. So what are some of the causes of depression? So depression always comes with a when someone has gone through a difficult event in their lives. For example, it is always loss. Okay, so it can be loss of your wife, it can be loss of your mother, loss of your beloved one. Okay, then there are people who also lose what? They lose jobs. Okay, we have had a lot of NGOs that have cut off their staffs because of funding. Like they send all our 50 people at home, and that person had no plan. So that one can make someone to have a mental, to develop depression. Then also, we are saying that it is caused by loss. It can be loss of a beloved one, it can be loss of a job, sometimes loss of property. Like we have had a lot of fire outbreaks whereby people lose a lot of billions or millions of money within one day. You wake up and they tell you all your shopping mall, all your supermarket, which you had invested in a lot of money, is gone. Why? Because of fire outbreak. So that one makes someone to think negatively, and you find them developing what? Depression. Depression can even put you, you become even, it put you in a wheelchair. Okay? So those that is one of the major causes of depression, but also it can be secondary to another infection. Okay, there is certain depression which can be caused because of a mental problem. Like when you have you are suffering from a mental problem, it also can make you to suffer from depression. Then we also have sicknesses like chronic sicknesses like HIV and AIDS. We have cancer. We have also diabetes, hypertension. These chronic illnesses, because you are taking medicine and you know that there is no treatment which I can take and I get healed completely, they make someone to develop the negative thinking, and someone develops what? Depression. That burden of taking medicine every day makes those people to develop depression. Okay, even just in the cancer, if they just diagnose that you have been diagnosed with cancer, make someone to be having what? To develop depression. Then also we also talk about substance abuse. Okay, people who take alcohol, people who take marijuana. One of the withdrawal symptoms when they have stopped taking marijuana or alcohol, they can also develop what? Depression. So those are some of the causes of depression. And how do we handle someone with depression? Okay, the first treatment, or the first line of treatment, is we call it psychotherapy. Okay, that is in a simple language we call it talk therapy. Okay, so there is a counseling style which you get, like someone who is having depression, we counsel them, and this is not a counselor. This other normal counselor, you must be a trained person, and we have different ways of talk therapy. There is what we call cognitive behavioral therapy, where you identify the patient is negative thoughts, then you replace them with what? With mature ones. Then you have to be an active listener. Okay, so we use CBT. If you have not watched my video about CBT, please watch it, because it has the knowledge of what I'm trying to talk about here. Then also we have medicine, what we call antidepressants. There are medicines that you swallow, which the doctor can prescribe for you, as long as you are as a combination of the therapy, the talk therapy, as well as also the drugs. Okay, so when we combine these two, you find someone what becomes fine. So if you are new to this channel, I request you to subscribe, and if you feel you have learned something, please let me know in the comment section. What are some of the signs that you have seen in people with mental, with depression, which have not been discovered by health workers, and let us end the stigma. Okay, depression is so common in the women than men. Of course, we know that women go through a lot of things in their lives, and also in the marriage. Okay, one of the things that also we forget about the cause of depression, it can be a broken relationship. It can cause you to have what? Depression. So thank you so much for listening. For the proper management of depression, about the talk therapy, please watch out my video about how to overcome depression in 4 steps, and it's a very good knowledge. And in case of medication, you're having someone suffering from that, please, you can get in touch with me. Also, there's what we call online therapy. Okay, thank you so much. See you in my next video.